Hello, I'm Craig Stern of Pharma Pharmaceutical Consultants. We've been talking about different topics involved with benefits, with HR benefits, pharmacy benefits, etc. And I want to take up a subject today that we've been asked about. Some people have been asking us the question that this term transparency is being thrown around, whether it's in pharmacy benefits, whether it's in medical benefits. What is this? What are people talking about? At the end of the day, transparency is the new code word for secrecy. Clearly, secrecy has a certain negative connotation, has to deal with secrets, and people don't necessarily like that. So there's a concern that, let's come up with a different word. And transparency seems to be the latest entry into the topic. The real question is, what are we talking about when we talk about transparency? What do we mean? Now, if you're a business, you clearly have certain things that are proprietary secrets, whether they have to deal with pricing, how much you pay for a given item or your cost of goods, or maybe certain processes that you do that are different from some of your competitors. So as a result of that, you want to keep these secret. But in real transparency, the issue is not to be contrary to business. The real transparency, it would seem, has to deal with what is involved in a contract that says that you, a health plan, you, a self-insured employer or a union or whoever, what are you, things that you are supposed to receive? And what information are you supposed to know? And if there is a lack of transparency in that regard, then there's clearly secrets and you want to know what they are. You want that information for multiple reasons. You may want to know, well, what am I actually paying for something? What is the actual cost of something? How do I go about verifying that I'm paying whatever the contract tells me I'm supposed to be paying? And frequently you want to know that not just under an audit scenario, but you also want to know it to ensure the fact that you can answer questions for your board, that you can answer questions for different physicians perhaps, or others that ask the question, and you can be honest and truthful about what that is. So the real question is, what is it that you're entitled to know, and what information do you need to have within an agreement so that you know that you have all of the information that allows you to verify that what is supposed to be happening is in fact happening. That's the transparency issue. It originally came up in pharmacy benefits over something known as rebates, which is nothing any different than a rebate that you might receive at a supermarket through a coupon, or that you might receive for buying a lot of goods from someone, and therefore you get some dollars back based on the volume of purchasing. And it then moved to pricing transparency. If you're paying for drugs, for example, what is the basis for that pricing? Am I actually paying for the correct numbers? And anyone that stood in the way, or anyone that gave an answer that identified that, well, it's a secret, I can't give it to you, it's involved with other contracts that I have. If it's involved in a contract or a benefit that you hold and that you are a party to, and that you are supposed to have that information, then any further information that someone's holding from you, that is a secret, and then that becomes transparent. So where do we leave off in this? Where does it matter? At the end of the day, as we might say, or at the bottom line, transparency means that we have to be able to dig to the information that we rightfully have, that we have to know in order to ensure that we have good information, that we understand what the issues are, what our costs are, what our quality is, what our indicators are, so that we have a way of ensuring that we are managing our business in an appropriate way. I look forward to speaking with you again. Have an outstanding day.